Well, hello and welcome back. My name is Dr. Martina Assad, and I'm the owner dentist of MA Dental. We are in Riverside, next to the Marsh Air Base. Today, I'm answering any questions about laser dentistry. What is laser dentistry and how it is used in modern dental care? Laser dentistry is not necessarily that new, but it is similar to red light therapy. So it is a little red beam light that goes and targets certain area depending on what we're trying to do. And here are the different uses for it. We can do the areas where the bacteria is around the gum line. We can decontaminate them and make sure you become bacteria free. It helps with lots of bleeding, people that have gum issues. It helps to kind of pretty much sanitize the area along with your hygiene appointments. Could be done during a cleaning appointment or could be done during a deep cleaning appointment. There are a million other uses for laser. Some people use it to remove some gum tissue if you're biting your gums in the back by wisdom tooth to get some relief. Some people use it to open areas up for surgical purposes, like a surgery purpose. Some people use it to fix an aesthetic concern of the patient, especially if the gum line in the front is kind of have different levels, which is not a painful procedure at all. And some people use it for implant placement. Some people use it. I mean, the sky's the limit when it comes to laser, but it's a very, very effective way of doing things compared to the old ways. Some people even use it for fillings. So it does depend on what kind of laser the practice would carry and what kind of services they offer, but it just have made dentistry so much easier. How does laser treatment work for gum disease? And this is huge in my office. So what we usually, both of my hygienists, including myself and my associate, we all use laser to help us seal the cleaning after the cleaning is rendered. So what the patient should expect, get a cleaning done. If you're having bleeding or sensitivity or like a foul odor or the gums are really aggravated and angry, usually we found oftentimes that cleaning alone is not sufficient, because you remove the bacteria, you remove the cement that is there, but the gums stay open like this. So what the laser does, the beam goes in, doesn't hurt again, and then what it does, it helps to shrink everything back and close this gap that is between the gums and the teeth, so nothing goes back in. So we find it great results with laser, especially to reduce the spaces that are down there. So the patient is not stuck trying to constantly cleaning and cleaning and cleaning with no result, or it gets disappointing on patient. People get so disappointed when they go back to the dentist after a deep cleaning session. It's like, what did you just do? Things are still not clean. So, and part of the reason why, because the gums are takes about 4 to 6 weeks to heal. So we think of laser as a booster to what is there. So instead of taking 4 to 6 weeks on healing, it can take a few days. And also it helps to reduce pain and sensitivity afterwards, and so is bleeding. What laser gum surgery involves, so gum surgery can come for multiple reasons, when that's not necessarily the question I'm trying to answer, but gum laser can, if we need to trim the gums a little bit to make the teeth even in height, that becomes some sort of a gum laser surgery. Some people use it to kind of trough areas and kind of shave down bony areas. That's also gum laser surgery. Some people use it to place implants and lift sinuses, which become part of like laser surgery in general. But the word surgery involves some sort of either cutting or some sort of reduction or some sort of fixing an issue. And usually it involves a little bit of bleeding, but the laser itself cauterizes the area and makes sure there's not a whole lot of bleeding involved with it. Is laser gum contouring or gum cutting is a common cosmetic procedure? And the answer, most often yes, depending if you have one tooth shorter than the other and you have enough room. Usually, as part of cosmetic planning, we like to contour, or pretty much the word contour meaning just like imitate what's happening on the right to the left, so we have some symmetry, and that requires a little bit of cutting, but again, doesn't hurt, no blood, heals on the spot as if you're brand new the next day. Are there benefits to choose laser dentistry over traditional tools? And the answer is absolutely yes. It's the technology in the laser and how it makes everything so much easier, versus doing something conventional methods. Again, it's almost the seal on the procedures that we do, and it makes life easy. It makes patients healing a lot faster and a lot better, and let alone the pain and the discomfort that usually happens after procedures like deep cleanings without laser. Super important. It is a great tool and helps to kind of add on what's there, but that doesn't mean that conventional methods are not great or not important, but this one kind of complements what's there. How do we determine if the patient is a good candidate for laser dentistry? It all starts with an exam. So if that's the case, and I'm hoping that you're still interested to hear about more about laser, you can feel free to call and schedule an appointment, and then after that we will sit down and diagnose and figure out to see which aspect of laser is needed. Maybe not at all, but the majority of people need some sort of a laser service in one way or the other. That concludes the video for today about laser dentistry. It's a really hot topic. I hope you enjoyed it as much as I did talking about it. If you'd like to hear more, we would love to see you at our office. You can feel free to call us back at 951 327 7247. We'll be more than happy to schedule you an appointment.